Anemia is a common medical condition characterized by a decrease in the number of red blood cells or a reduction in the amount of hemoglobin, the oxygen-carrying protein, within the red blood cells. This deficiency in oxygen-carrying capacity can lead to various symptoms and health problems. Anemia can result from a range of underlying causes and can vary in severity. Let's explore the causes, symptoms, types, diagnosis, and treatment of anemia. Causes of anemia. Anemia can be caused by multiple factors, including iron deficiency anemia, insufficient iron intake, poor absorption, or excessive bleeding, for example, heavy menstrual periods, can lead to this common type of anemia. Vitamin deficiency anemia. Deficiencies in vitamins like B12, folic acid, and vitamin C can affect red blood cell production. Chronic diseases. Conditions such as chronic kidney disease, inflammatory disorders, and certain cancers can interfere with red blood cell production. Hemolytic anemia. Red blood cells are destroyed faster than they are produced, often due to autoimmune conditions or inherited disorders. Aplastic anemia. Bone marrow fails to produce enough blood cells. Hemorrhagic anemia. Severe blood loss due to injury, surgery, or internal bleeding can lead to anemia. Symptoms of anemia. The symptoms of anemia can vary based on its severity and underlying cause, but they may include 1. Fatigue and weakness. 2. Pale or jaundiced, yellowish, skin. 3. Shortness of breath. 4. Rapid or irregular heartbeat. 5. Dizziness or lightheadedness. 6. Cold hands and feet. 7. Headaches. 8. Brittle nails and hair loss. Types of anemia. There are several types of anemia, each with distinct causes and characteristics, including iron deficiency anemia, most common type, often caused by insufficient dietary iron intake. Vitamin deficiency anemia, includes B12 deficiency anemia and folate deficiency anemia. Hemolytic anemia, red blood cells are destroyed faster than produced. Aplastic anemia, bone marrow fails to produce enough blood cells. Sickle cell anemia, a genetic disorder that leads to abnormally shaped red blood cells. Diagnosis and treatment. Diagnosis involves a physical examination, medical history review, blood tests, complete blood count, iron levels, vitamin levels, and potentially other tests to identify the underlying cause. Treatment options depend on the type and cause of anemia. Dietary changes. Increasing iron-rich foods, red meat, dark leafy greens, beans, vitamin B12 sources, animal products, and folic acid-rich foods, fortified cereals, legumes. Supplements, iron, vitamin B12, or folic acid supplements under medical supervision. Medications, treat underlying causes or complications, such as medications for autoimmune disorders. Blood transfusions. In severe cases, blood transfusions may be necessary to restore red blood cell levels quickly. Bone marrow transplant, for severe cases of aplastic anemia or certain genetic conditions. Lifestyle changes, managing underlying conditions, avoiding excessive alcohol, and quitting smoking. Conclusion: anemia is a common condition that can significantly impact overall health and well-being. Early diagnosis and appropriate treatment, guided by a healthcare professional, are essential for managing anemia and preventing complications. If you suspect you have anemia or are experiencing symptoms, it's important to seek medical advice for proper evaluation and personalized care. Detailed article on anemia. Title: Anemia, Causes, Types, Symptoms, Diagnosis, and Treatment. Introduction. Anemia is a widespread medical condition characterized by a reduced number of red blood cells or a lower than normal concentration of hemoglobin in the blood. Hemoglobin is a protein within red blood cells that carries oxygen from the lungs to the body's tissues. Anemia can affect people of all ages and backgrounds and can have a significant impact on overall health and well-being. In this comprehensive article, we will delve into the various aspects of anemia, including its causes, types, symptoms, diagnosis, and treatment options. Table of contents. Understanding anemia. 1. Definition and significance of red blood cells and hemoglobin. 2. How anemia affects oxygen delivery and tissue function. Causes of anemia. 1. Iron deficiency anemia, insufficient iron intake or absorption, and chronic blood loss. 2. Vitamin deficiency anemia, lack of vitamins such as B12, folic acid, and vitamin C. 3. Hemolytic anemia, accelerated destruction of red blood cells due to various factors. 4. Aplastic anemia, bone marrow failure to produce enough blood cells. 5. Sickle cell anemia, genetic disorder leading to abnormal hemoglobin and red blood cell shape. 6. Chronic diseases, how conditions like chronic kidney disease and inflammatory disorders contribute to anemia. Signs and symptoms. 1. Fatigue, weakness, and reduced energy levels. 2. Pale or jaundiced skin. 3. Shortness of breath and rapid heartbeat. 4. Dizziness and lightheadedness. 5. Cold extremities and headache. 6. Brittle nails and hair loss. Types of anemia. 1. Iron deficiency anemia, most common type and its causes. 2. Vitamin deficiency anemia, including B12 deficiency and folate deficiency anemia. 3. Hemolytic anemia, autoimmune and inherited causes of accelerated red blood cell destruction. 4. Aplastic anemia, bone marrow failure and its effects on blood cell production. 5. Sickle cell anemia, genetic basis, symptoms, and complications. Diagnosis and medical evaluation. 1. Physical examination and medical history assessment. 2. Blood tests, complete blood count, CBC, iron levels, vitamin levels, and reticulocyte count. 3. Additional tests, hemoglobin electrophoresis, bone marrow biopsy, in certain cases. Treatment and management. 1. Dietary adjustments, iron-rich foods, vitamin supplements, and balanced nutrition. 2. Iron supplementation, dosage, benefits, and considerations. 3. Blood transfusions, indications, procedure, and potential risks. 4. Medications, addressing underlying causes, such as autoimmune disorders. 5. Bone marrow transplant, applicability and considerations for severe cases. 6. Lifestyle changes, managing underlying conditions, alcohol consumption, and smoking. Prevention and outlook. 1. Dietary strategies to prevent iron and vitamin deficiencies. 2. Regular health checkups and screenings. 3. Importance of early diagnosis and treatment for better outcomes. Conclusion: anemia is a multifaceted condition with various underlying causes, types, and potential complications. Timely diagnosis, comprehensive medical evaluation, and appropriate treatment are essential for effectively managing anemia and improving quality of life. By understanding the causes, recognizing the symptoms, and seeking proper medical care, individuals can take proactive steps to prevent and address anemia, ensuring optimal health and well-being. If you suspect you have anemia or are experiencing related symptoms, consult a healthcare professional for accurate diagnosis and personalized treatment guidance.